So there's been a whole shift in the management of abdominal aortic aneurysms over the last decade. And previously, it was primarily fixed with an open repair. So a large midline incision, operation goes perfectly, patient's in the hospital for a minimum of 5 days. Okay. Now we fix them with stents, and we probably fix 80 to 90% of the aneurysms with stents. And basically, you know, a stent is a tube that goes on the inside of the aneurysm sac, okay, and essentially excludes that sac from the blood flow. So to do that, you have to be able to deliver it under fluoroscopy. So what really pushed hybrid operating room systems was there was this dilemma when you would do these aortic stent procedures as to whether you do them in a cath lab, which has what's called a fixed fluoroscopy unit. So a fixed fluoroscopy unit has superior imaging quality, but you have the safety concerns of being in a cath lab and not in an operating room where you have all the abilities at your disposal to be able to convert to an open procedure if a complication were to occur. And there was also concerns of the sterility of a cath lab. It's not as sterile as an operating room suite. If you were to do the procedure in the operating room, you do it with what's called a mobile C-arm. Okay, so it's a smaller, more mobile imaging device, but the image quality is certainly poor. And the solution to that was to go ahead and put a fixed fluoroscopy unit actually in an operating room.
Another advantage of this room is that it allows people from different disciplines to all work together in the same environment to give the patient the best possible outcome. Again, traditionally you've had sort of teams of healthcare providers that work in the operating room and teams of healthcare providers that mostly work in imaging. And with the hybrid room now, we can move those two teams together, and we can work in harmony to provide the best outcomes for patients.
It really empowers the surgeon to really make the best decision for the patient at that time in the operating room. So because you have, if the case isn't going well, because you have the imaging equipment right there ready to go, if you need to problem solve or work through an issue, you already have the technology there to do that.